indicates that you won't be able to keep what you have even if you like it. Another thing we constantly hear from the president is, if you like what you have, you can keep it. But believe me, if 114 or 125 million of the 160 or 80 million people that get their insurance at work go to the new subsidized government plan, what you like won't be there anymore, and the cost will go up. It'll just those things will disappear, and then you have government-run health care. And we want to have some discussion about that today. We have 3 witnesses with us and 1 witness on the phone with us from the United Kingdom. So 4 witnesses to testify, 4 witnesses to ask questions of, and I'm struggling a little bit to decide the exact best way to do that. But since I don't think we've gone to the second vote yet, I'm going to go ahead and introduce Shona Holmes. Shona's traveled from Canada to be with us today. She was diagnosed a few years ago with a brain tumor, and because of the system in Canada, she was told it would be months before she could see a neurologist in Canada. Fortunately, if you live in Canada, you're not too far from the United States, and in her case, you're not too far from the Mayo Clinic, and she was able to go there and receive treatment. And Shona, we appreciate the personal effort you've made to be here today, and we look forward to your testimony.
Can I figure this out?
I don't know. I think mine is on.
Trust the Canadian enough, we will do it.
Now somebody's going to have this here.
I think you're on.
Hello?
Yes.
Hey.
There you go.
Thank you very much.
Sorry about the mic problem.
No problem. I feel strongly that if we don't start talking to each other in the same language, that the truth is going to get lost in the translation of this debate. It has always been my view and my message that both Canadians and Americans have so many misconceptions about each other's current healthcare systems. I have chosen to become involved to offer the patient's point of view from the misconceptions using my personal experience from both sides of the border. I left Canada for diagnosis in the United States because I could not access diagnosis in a timely manner with specialists for my condition, which was becoming gravely worrisome. This is often the part of wait times that is ignored by studies and the improvements within our healthcare system. As many as 1 in 6 people in Ontario are without a family doctor, and that is the gateway to your care and to specialists. Out of 33 million people in Canada, which is the same population as the state of California, we have 5 million people that are without access to a family doctor. I was fortunate enough to have a family doctor, one that cared for me very deeply. She was unable to expedite the tests we needed, nor the specialists, the diagnostic testing, the imaging, the blood testing, and some of which weren't even provided under our government-run health care. One simple blood test could have saved me grief and expense that's not even available in Canada. Not because we can't do the test, it is a simple blood draw, but because the government mandates the lab hours. I required a test at 11 p.m. at night, and the government closes at 7. Within 1 week, I received a complete comprehensive diagnosis from 2 former Canadian doctors who now work at the Mayo Clinic in Arizona. The most amazing part of my story, I feel, is that both of these doctors recommended I go home for this surgery and for follow-up testing, as we now knew what the issue was, that I should have been able to be treated rapidly through our free health care or government-run services. Confident that I was armed with the information required to be triaged to the emergency list, this was sadly not the case. I was to find out many months later that doctors in Canada are not required to take other doctors' reports. The doctor I saw refused to review my records, read the diagnosis, and worse yet, personally declined a call from the Mayo Clinic doctor himself as he frantically contacted him with updates on my condition. Sadly, stories like mine are not a rare case, as some are trying to discredit me by saying, our country is using the United States on a regular basis to help out with emergencies when we arise. We are lacking the resources to sort them out ourselves. As recently as 2 weeks ago, 2 premature babies were born in one of the largest teaching hospitals in my city, and there were no facilities available for them. One was sent to Buffalo, New York, while the other was sent to Ottawa, some 7 hours away. The month that I came to the U.S., 26 people were whisked across the border for brain surgery due to a lack of neurosurgeons. I could pound story after story in this discussion, but the most compelling thing to me was the other day when I spoke to the border guard, reported to me the numbers daily of people that are crossing the border from Canada to the United States for cancer treatment, MRIs, and other emergency treatment, and he wondered why people in the U.S. were glorifying the Canadian system. We have government websites that post targeted goals for wait times in our areas, as well as the average wait time, and sadly, we are never near target. Lost in the language is coverage. The basics that Americans have complained to me about not being covered is not covered in our government plan. Things like prescription medicines, eye exams, unless you're referred to an ophthalmologist, and the wait times to see ophthalmologists are up to 1 year. Hearing tests, and even things like a cast on your leg if you should break it. The doctor tending your injury will be paid for his services, but you will be out of pocket for the cast, the crutches, the physiotherapy, and the ambulance ride to that hospital. I'm saddened by the glib attitude that if it didn't happen to me, that it can't be true. Canadians are terribly proud of our health care because we fear what we have been raised to believe what America is like. No insurance coverage is very different from no access to care, nor the ability to step out of the system and take care of yourself and or your family without being fined. To leave your country to get treatment in a timely manner alone tells a tale of too much government control. I have yet to meet an American who boasts about the health care in both the Medicare process already in place in the U.S. or your VA hospitals. Sadly, many of those stories only mirror our whole system. This debate seems to polarize people. It's polarizing points, and worse, it's polarizing professionals. When I watched President Obama give his speech the other day, and he spoke how he was surrounded by nurses because they didn't choose the profession to get rich, it drummed into me what the problem was. This is unfair to assume that the driving costs of health care lay on the backs of only one specific field of individuals, be it doctors, the medical profession, the pharmaceutical companies, the insurance industry, or patients themselves. This is irresponsible. Canada, with our, quote, free health care, battles the exact same suffering, the exact same issues under socialized medicine. Health care is expensive. Our only way to control costs is not through competition, not through choice, but with more taxes or rationed services. Everyone wants and deserves health care. They want affordable health care, but most importantly, they want accessible health care. This is the lesson that I've learned in the past few years. Looking back, I chose what kind of Canadian statistic I would become. I mitigated my own damages. I came to the United States and I saw firsthand how a top quality system could run. And I chose to become involved and speak out. Thank you.
Thank you. We're going to take a 10-minute break, and at 10 minutes till, we'll start uninterrupted and finish this up, and we're going to go cast a couple of votes and be right back. So we will be right back and get started 10 minutes from now.
So as you heard, there will be about a 10-minute break in this discussion by House Republicans on health care legislation. House members are returning to the House chamber to vote on a number of different pieces of legislation. Again, 10 minutes. We'll return to this live here on C-SPAN 3. Until then, your phone calls from this morning's Washington Journal.
Obama scolds Cambridge police. President, a friend of Gates, says officers acted stupidly. Inside the newspaper, right on the front page below it, here's a photograph of the sergeant who was involved in the arrest. And as we look at his picture, here's what Jack Nickus, Globe correspondent, is saying. William B. Carter, excuse me, wrong story. Let me find this one. Sergeant at Eye of Storm says he won't apologize. When Sergeant James Crowley climbed the front steps of Henry Louis Gates Jr.'s house last week and unexpectedly placed himself in international headlines, it was not the first time he had a memorable encounter in the line of duty with a prominent black man. Nearly 16 years ago, as a Brandeis University police officer, Crowley desperately tried to save the life of Reggie Lewis after the Boston Celtics star collapsed while practicing in the school gym. Crowley was a certified emergency medical technician when he performed CPR on Lewis to no avail after the player's heart stopped on July 27, 1993. In a Globe interview that day, Crowley said he rushed to the university's gym, confirmed that Lewis had no pulse, and frantically tried to revive him. Now, 16 years later, he stands accused of racism by Gates, one of the foremost scholars on race in America. Let's hear your thoughts on this, beginning with the call from Everett, Washington. Go ahead, please.
Hi. I just wanted, everybody's missing a point that if it was, just put yourself in the place of Professor Gates. If it was your house and this police officer came into your house, everybody would be upset. And I think if cooler heads would prevail, then it would have, he would have just said, okay, thank you very much, and go on. But because he was black, I don't necessarily think it was racist, but I definitely think there was some profiling going on there.
What does the discussion that has ensued nationally say about the state of race relations in America to you?
I think it has improved with President Obama, but it definitely has we still have some work to be done.
That's Eddie in Everett, Washington. Thank you for your call. Next up is a call from Spring Green, Wisconsin. This is Joe on the Independent line. Good morning, Joe.
Hi. I'm a little bit confused over the delay here. I have my television muted right now. I'm transplanted here from Illinois. I lived in Darien, Illinois, and a similar thing happened to me. I had locked myself out of the house and went around the house and got myself a ladder out of the garage, and I was climbing through my window, and sure enough, the Darien, Illinois police showed up at my house with guns drawn, and my initial reaction was I was mad. Hey, this is my house, and they didn't really back down right away. After thinking about it, I was proud of these guys. I mean, you know what? If it was somebody else that was breaking into my house, and all they had was my word for it that, hey, I live here, I mean, hey, these guys were doing their job. If the case is that you want the police to, calmly question someone that's crawling through a window, without their guns drawn or whatever, then, you know what, voice your opinion and say, you know what, police shouldn't hassle people climbing in a window until they find out the situation. These guys, I feel like they did the right thing, and if it was a stranger climbing through my window, I would hope that these guys would show up in force and with serious faces on and ready to do what they had to do to protect the property. I mean, it was actually one of my neighbors who, it was dark out, but they didn't know who it was, and they called the police, and the police responded, I think, appropriately. And as far as the profiling, there's a project in the city called Cabrini Green in the city of Chicago, which is mostly blacks. Now, I had nearby, there's $500,000 condos of rich people, and I happened to be working there, taking a shortcut through Cabrini Green, and the police pulled me over because, frankly, a white guy driving through that little section of town there is usually up to no good. I mean, there to buy drugs or pick up a prostitute or whatever. And initially I was, I had feelings of empathy for, the black guys that get pulled over in white neighborhoods. But at the same time, these guys are doing their job. And as far as racial profiling, I didn't